Hi, Assalamualaikum. I am Teacher Aisha. So today I'm going to present about the developmental coordination disorder. So this is a definition for developmental coordination disorder ataupun in short form is DCD. Okay. So what is DCD? DCD is an absentional clumsiness or an unusual delay in meeting motor milestones of childhood when such a delay results in functional impairment and cannot be attributed to other medical condition. So DCD also known as dyspraxia. Okay, so in the medical term ataupun in the hospital, the doctor use DCD to describe this disorder lah to particular patients, but diorang tak menggunakan dyspraxia because dyspraxia is common word to use for any condition. Contohnya in stroke patient who got coordination problem. Okay, so basically in hospital untuk a patient who got the developmental coordination disorder, so they akan describe with DCD je. Okay, so what is dyspraxia? Okay, so now we are going to talk dyspraxia because DCD is very quite similar with the dyspraxia. So dyspraxia is a condition affecting physical coordination. It causes a child to perform less well than expected in daily activity for their age and appear to move clumsily. Alright, so as I mentioned before, dyspraxia and DCD is similar. So now I'm going to talk about the types of dyspraxia in children. So they have three types. The first one is a motor dyspraxia, where difficulty with fine motor skills such as writing, dressing, and balance. The second one is oral dyspraxia. So this is a difficulty with coordinating parts of mouth that creates the words. Okay, last one is a verbal dyspraxia, difficulty coordinating and producing clear speech. Okay, a person who got the DCD, they have a problem with coordination. So the coordination is very involving a very few parts. Okay, bukan a few parts, a lot of parts, which is coordinations of the hands, coordination the legs, coordination your eyes, mouth. So they are very affected to every parts untuk a person do a activity daily living. Okay, so this is a few types lah. So we need to know a few types before we go to another parts. Alright, due to this problem ataupun this disorder, so they have a very stigma about the surrounding. Okay, people who see a person who got a DCD ataupun dyspraxia. So despite the high risk of the dyspraxia, people unfortunately still often hold several misconceptions about the children with dyspraxia ataupun DCD. So what they think and what we are going to do to say a facts. Okay, so the first one is a misconceptions for people who say that they have a lack of literacy skills due to poorer level of intelligence. Okay, so in fact is they only unable to perform what they plan to do because they have ability to think, to do, but they have just diorang tak mampu je nak buat sebab diorang ada masalah coordination tu. So bila ada masalah coordination ni, mereka tak ada keupayaan ataupun strength untuk buat sesuatu benda. Okay, they dah fikir, they have plans, they have thing to do, but physically mereka tidak mampu because of this disorder. Okay, the second one is they are just INAP. INAP is surrounding akan fikir mereka tak ada skill langsung. Sebenarnya mereka ada have trouble with coordination of motor skills sahaja. Okay, macam same point same as first point lah. So mereka ada benda diorang boleh fikir. Contoh nak ambil pensel, diorang tahu to move your hands, to move your fingers to grab a pencil, but diorang tak mampu in physically to do because of have a coordination problem too. Okay, the third one is a people will think that there is no treatment, they can only outgrow it, which is diorang tak ada treatment tu, padahal in the facts they have a multidisciplinary team approach involving a speech and occupational therapist can benefit them greatly. Okay, so sekarang ni kita ada era yang baru di mana kita ada solution di mana kita boleh hidup with that. Kita tak boleh nak pandang person who got the dyspraxia cannot have tak ada treatment yang tu. Sebenarnya ada. Okay, kita kena just open minded and try to terima whatever condition to the person. Okay, alright, so next one is the symptoms of DCD. The first one is delay in early milestone. Okay, awkward or clumsy, difficulty with writing, doing up their buttons or shoelace, or running and jumping. Difficulty learning new skills, bump into other people or objects, become tired easily, avoid tasks they find difficult such as handwriting, and difficulty changing their clothes. Okay, for the causes, the causes have been researched but still unknown. However, a number of risk factors that can increase a child's likelihood of developing DCD have been identified by being born prematurely before the 37 weeks of pregnancy, being born with a low birth weight, and having a family history of DCD, although it is not clear exactly which genes may be involved in the conditions. Okay, the last one is the mother drinking alcohol or taking illegal drugs while pregnant. Okay, before the evaluation, patient who got the DCD ni, mereka akan melalui satu proses di mana dapatkan diagnosis from pakar ataupun terapi, which is from the pakar dia orang akan ambil daripada pediatricians and developmental behavioral pediatrician, pediatric neuro psychologists and child psychiatrists. Okay, so for the therapists also, they will get from the physical therapist or occupational therapist, educational evaluations, psychologists and researchers. Okay, so before we go to the evaluation, so a patient will got advice from a doctor and also from the therapist. So from that, what they see ataupun apa yang mereka akan buat untuk check sama ada a patient tu got DCD or dyspraxia is to check the strength, muscle strength, to check balance of body, okay, to check the coordinations, okay, to check range of motion, which is the joint movements for all joints, motor planning, how they can plan to do, which is as example to hold pens, to button your shirts, to do walking, we see how they walking. Okay, so fine motor control is involving with the hands lah, hand movement, fingers movement. Okay, so this is what they will do during see the doctors and therapists. Okay, that's all from the developmental coordination disorder. So basically what we can, they have no cures, tak ada solution, but they can be treated by the therapists. Okay, the therapists from the OT, from the physiotherapists, from the behavioral therapies, and also for all the therapists can help them to live with the condition. So that's all from me. Thank you.